Welcome into the Family Pet Podcast, the podcast for curious pet parents, because we believe the more you know about pet healthcare, the better pet parent you can be. I'm your host, Michael Shirley, joined by my co-host, Stephen.
You
I
just
just had a
you
break.
just
I was like, I need nobody.
you
has
feel bad
sense.
because I posted such nice things on LinkedIn about you
It's true.
yesterday.
Yeah, I don't want to make fun of you. I'm trying to do better in 2024.
That's quite the
I figured
New Year's
this is our
resolution.
third year of this podcast. I figure it's
It's
time to
about
stop.
time to move
Time to
past
start
making fun
moving.
of
Yeah,
me.
making fun of you, but I don't know. My brain wasn't working very well to come up with something creative to say. So maybe our guest today can help.
Yeah, brain problems.
That's
That may be it. That's a good segue.
That's
You
right.
did not intend that.
Well, you never know how these intros are going to go. But we appreciate all of you listeners out there, and feel free to send me any little intros I can give for Stephen. Or maybe your request is that I get a new co-host. I don't know.
Oh, that's harsh.
I don't know. But today we have a special guest that's going to be joining the podcast to talk a little bit about veterinary neurology. And that's Dr. Christiane Massicotte. Dr. Massicotte, thank you for joining us today.
Thank you for having me.
Well, we're going to get right to it because I have a lot of questions about what you do as a veterinary. Can you just tell us what does a veterinary neurologist do? Because when I hear that, I just think about brain function, but I know it's way more than that.
Yeah, well, the patient gets referred to us for multiple reasons. We have a lot of, you have the dogs that have seizures. So we have a lot of that. So like you said, brain disease, we deal with that a lot. But we deal also with a lot of spinal injury. And the injury, by that I mean it can be anything from a herniated disc to a spinal fracture. So we do see also a lot of spinal disease. We do some also hearing tests. We also, as a neurologist, are responsible for the peripheral nervous system and the muscle diseases. So we deal with that part of the nervous system as well. So there's all sorts of machine we have in veterinary medicine that test nerve conduction, muscle function, and we have also ways to evaluate spinal diseases and brain diseases with certainly different kind of machines.
So I want to jump in for a second because you mentioned I've had this surgery.
Oh, yeah. This is Steve. Stephen's been waiting for this podcast.
So I didn't know. I had a lumbar discectomy and laminectomy. I don't know where they went in. I had a herniated disc.
Mm-hmm.
Our pets can get herniated discs as well?
Yes, in fact, it's a really, really big part of the referral pool is herniated disc. There's always a dachshund, a Frenchie in my practice somewhere that can't walk. So these diseases, if taken in time, are very treatable, permanently treatable. We can reverse the disease. Sometimes it does require, like you say, surgery. So we do a lot of surgery. So spinal surgery, it's a little bit different as far as technique as in humans because our patient walk hopefully in a different manner than we do. So we're standing up and that press a lot on the disc in a different manner than if you are walking on four legs. So our procedures are a little bit different, but we do a lot of herniated disc removals or surgery, even some disc replacement. We have arthroplasty for that. We have artificial discs that we can place. There's like little mini discs that work on itself. They're artificial joints, if you want.
For pet parents that are out there, maybe they missed our previous episodes about some of this discussion. Can you tell us what, when you say a herniated disc, what does that mean? So I know you may have some visual aids there in the office, but if you're trying to explain this to people that are just listening, what is a disc disease, or like what is a disc in a spine?
So a disc is a cushion between the vertebra. So it lies underneath the spinal cord. So, and it provides a little bit of movement, flexibility to the spine, and prevent it from shocks, bone against bone. So it's like a little articulation, if you want. So it's a pillow in between two vertebrae. And that pillow, let's say you are a dachshund, that pillow with time degenerates. So it becomes harder. So it's full of calcium instead of being full of plastic material. And then it is more prone to get injured. There's a little ligament on top of that disc here, right? And with time, it gets weaker. And with a minimum trauma, the disc can rupture.
So
and when it does that, it compresses the spinal cord, and then the dog can't walk anymore.
because
lots of pain.
because the nerves are getting pinched in between
Correct.
the two
The
bones.
spinal cord entirely can get pinched, and yes, it causes a lot of discomfort as well. Can't walk, and they are in extreme pain when that happens.
And my good friend Dr. Adam Chrisman wrote a book called "Honey, Have You Squeezed the Dachshund?" And it's a really great book. It talks about intervertebral disc disease, or IVDD, which many people may have heard about. So I'm going to have him back on the show to talk about his experiences with a paralyzed dachshund. But it's a great book. So we talked a little bit about disc disease. You mentioned many other things like seizures, hearing, vision. What are some signs that our pet parents might see in their dogs or cats that would be like, oh, I think a trip to the neurologist is in store for us?
Well, there's some that's self-explanatory. I think if you have a seizure, you got to see the neurologist, I think, or at the very least, your primary doctor. But that's serious, right? Now, if let's talk about the brain things, because it's a compartment. You have the brain, the spine, and the peripheral nerve and muscle. So let's talk about the brain. If you see seizure, definitely it's a sign of going to a neurologist. If your best companion that you know forever start behaving in a very weird way, that's not a normal behavior that he shows, get lost somewhere, get stuck in corners, not normal, then you should also, that should be an indicator that something is going wrong. And same thing, in the brain, again, you have the places, and in the middle here, where it does control your balance. So if you see that your pet is off balance, and we call that the vertigo, right? In humans, people can't get up and they're all spinning down in their bed, and it's very debilitating when that happens. Well, that definitely the neurologist is usually also taking care of these problems. So for the balance, it can be just as simple as having an ear infection that's deeply seated in there, or it could be something in the back part of the brain where the balance is controlled as well. So that is for the brain only. Now, if we talk about the spinal cord, of course, if you see your dog starting to be wobbly, either in the back leg or in the front leg, or favoring one of the front legs or the back legs, then there's something wrong. Or if also they're having difficulty getting up or sitting back down because it seems like it's painful, this is something that we probably should evaluate relatively quickly before things get worse. So this is for the spine. So spinal pain, so represented by, I don't want to get up, I don't want to sit down, pacing, because you can't get comfortable. So these are the sign for spinal diseases. And of course, the obvious, well, I can't walk. So, and for the muscle and the nerve, then those dog also has difficulty to walk. They can be painful or not painful, but the signs is that they look a little bit, their gait is like a little bit of a floppy fish. They have no tone anywhere. So that's also deserve a trip to the neurologist.
All right. Before for pet parents, if they were to see any of these, would they can they call directly to a neurologist, or do they usually go? Do you only see referrals from general practitioners to you?
Well, I think the first thing that the owner will reach out to is the person that they know, right? A lot of
Sure.
people don't even know, and we're doing a very bad job at advertising ourselves as
Well, not now.
specialists.
You've joined the Family Pet Podcast,
Yeah,
so we're
but
sending everybody.
I know, but for a lot of you would not believe how many people, including humans, that pets exist. So
Right.
I think the first reaction that a pet owner will have would be to contact the regular vets, like, my dog can't walk. And that usually the regular vets are very good at knowing what they can and cannot do, and then direct them to us if they need to see us. But yes, we usually see mostly referral. But when, for example, here we have also an emergency practice, uh, people that will see, oh my God, my dog can't walk, they're coming to the hospital.
Hmm.
And we always see them because the emergency will say, that dog doesn't walk. Hey, Dr. Massicotte, that's your turn. You go ahead and look at that. So, but
Yeah.
I
Good.
don't know if that answers your question.
No, it
No,
definitely
that's
answers our question. Um, in an acute in any of these issues, an acute thing, you're going to go to the ER, and hopefully they have specialists there, or they'll be able to refer you to a specialist, or something that's maybe. I think about like the balance issues. That's probably something that you'll be like, "Man, I think I'll just call my vet," and then we would refer to a neurologist.
But
Our doctors, I know our doctors are quick to. They're going
uh,
to obviously do some diagnostics to make sure that it's not an ear infection, but then after that, they're going to be quick to
right,
send it to the specialist. Yeah. Because
right,
that's
and then
what you do.
until
That's you're a specialist.
you're boarded and
Yeah.
trained.
yes, yes,
So we've talked about how to for our pet parents when they spot issues, and we've talked about what to do. You go to your primary veterinarian if it's something more of a chronic, if it's an acute, especially if it's after hours, you're going to go to an ER.
that's
But
correct.
when they come to you, we've already talked about surgery.
Mhm.
Um, what are the treatment options? And I know this is a broad question
Right.
because there's a lot of different. You have explained more. I thought it was just
spine,
this,
nerves, and muscles. Yeah, brain, spine, nerves, and
so
muscles.
what are treatment options? What do you do to
Well,
help
first
our
of
pets?
all, well, in order to prescribe the right treatment, we need to have the right diagnosis, and that starts there. So when they come with, let's say, or let's talk about that vertigo, the dog with a head tail that can't barely stand up. So you need to know what's going on and why it's having that, because the treatment for an ear infection will be greatly different than if the animal has a stroke or a vascular event to their brain. So number one, you need to identify the reason why the clinical signs happens, and then you can formulate the best course of treatments for your animal. So for an example, again, for the brain, the neurologist likes a lot of two of those things for the brain, an MRI, which we have here. So to look in the brain, to look in the middle ear, there's nothing better than the MRI for the soft tissue in the brain. So we would definitely recommend that. And if we suspect that there could be a meningitis, then we would do a cerebrospinal fluid. So that is collecting fluid around the brain, and that detects meningitis usually all the time.
Mm.
It's like the blood work for the brain, because infectious disease or inflammation in the brain will not cross in the blood because there is a very tight blood-brain barrier.
Right.
This is very convenient when you don't want to have your common cold going to your brain, but
Right.
when you want to have information about what's going on in the brain and you take blood, you're not really successful either. So you need to take that precious golden spinal fluid that will answer some of those inflammatory questions. So and the treatment will depend on that. So treatment for a tumor, there is people hear tumor and they stop hearing anything else.
Sure.
But
Right.
There is treatments for that, as less invasive as just giving some medication to reduce the swelling around the tumor, to giving chemotherapy to shrink the tumor, to removing the tumor surgically. We have a CUSA, we have also we can follow it through nowadays with radiation therapy, which we have in just the other building right next door. So we can actually put these dogs in remission for a long time. And depending even on the kind of tumor, it can be for the time that the dog will be living, because something else may get them before the tumor do. So it's always worthwhile to know what kind of tumor we have,
Right.
and to see what kind of prognosis we have. Can we treat them for a long time, or is it kind of going to be difficult? But there are treatments for that. We can give them sometimes several years.
Okay. That's what I was going to ask.
So in a dog year, it's pretty good.
That's pretty good. Yeah. So
It's never good enough, but all
Right.
considering.
the can you talk a little bit, like I was going to ask you about treatment options and prognosis. Are we seeing those increase year over year, like the technology, the treatment
yes.
options? Or tell us a little bit about that.
All right. Well, I'm old, right? That's said and done. That's said and done. So when I was a resident, a long time ago, we did not have the medication that we have today. We have pretty powerful immunomodulating agent for those meningitis that we would, back then when I was a resident, we would lose 95% of these patients.
Wow.
To meningitis that are immune mediated. That what we say GME, but it doesn't need to have a name, but we used to lose 95% of those patients. Nowadays, if I lose 5% of them, that would be it.
Wow.
So big, huge progress in that. And also tumors. We didn't even have an MRI where I was. It was very rare. So we were stuck in a city where we would be missing 2 centimeter mass in the brain. So we were not very efficient and planning surgery, and also radiation therapy did not exist. So the technology have absolutely exploded and has become available not only for human but for veterinary medicine. What we have back there for radiation therapy is what they use for humans, the latest technology possible, and we have the privilege to be able to use that for our pets that have tumors. So this is huge.
So when you were talking about tumors, we've talked about surgery for IVDD,
Right, that
intervertebral
is
disc.
curable as well. That's a treatment that's totally curable.
And when we talked about, you said one of the most common reasons is seizures. So it sounds, again, so many different parts, so many different complicating factors. But you're saying
seizures
that
are very treatable, and the more we know about why the seizure is occurring. So again, you need to have a diagnosis. So we could have a tumor, we can have a meningitis, we could have an infection, we could have genetic epilepsy. So genetic epilepsy is a diagnosis by elimination of other things. My point is, yes.
Go ahead.
My point is, if you just throw anticonvulsant at those animals, not knowing the real cause, the problem is you're just putting a band-aid on the seizures. A band-aid that, if you don't treat the boo-boo underneath, the blood's going to pour through your band-aid eventually, and your medicine is not going to be effective because you're not treating the primary cause for the seizure. So for me, it's always important to make sure there's no reason for having the seizure. If you do find one, you treat that. And you may not even need seizure medication, or a whole lot less if you treat the primary disease. Now, if you have genetic epilepsy, then there's a whole bunch of combination of medication, anticonvulsant that we can use. many that are available nowadays to treat these seizures. So there's a lot of options for that as well. These are usually very treatable disease.
I think that the advancements in technologies and options and medications, the fact that we have a podcast dedicated to educating pet parents just shows how strong the human animal bond is and how far we've come and how much our pets are considered parts of our family now.
Yes, that's
And
certainly true.
with that in mind, we've covered a lot. Is there anything that you would like for our listeners to know that we haven't talked about today?
We talked about a lot of things.
Yes, we did.
No, I think yes, actually. I think for a lot of people, even including our veterinarian out there, neurology is very scary. I see students coming to neurology, and if they would be a dog, their tail would be way tucked in underneath. They are afraid of it. I don't know, it's a myth because it's not all that complicated. Everybody thinks, oh, it's neuro, it's gonna die. This is so not true. It's very rare that I lose a patient, actually.
That's good news.
That's
so,
hope.
I like hearing that.
I just wrote it down. I just wrote it down right here to say hope. Like you're
it's
giving
not
hope.
because
Yeah.
it's neurology that it is bad. And that's what I really want the people out there to know. It's really worth trying to treat because very, very often we're successful. We bring them back their quality of life, and we help the owner and we help the dog dealing with their disease if it's not curable, but we can improve their quality of life, and we're really all about that here. Quality of life is very important for both the pet owners and, of course, their companions.
And I feel
That's pumped up. I'm ready to go.
I feel like I just listened to the let's go.
That's
pump
right.
up music.
Well, Dr. Massicotte, thank you so much for sharing your knowledge and providing some hope for people that maybe have a diagnosis with their pets, a neurology. They're getting referred to a neurologist, and maybe they've gone to the Google machine and typed in something
got scared.
and they found the Family Pet Podcast. And today,
bad information back there. Googleitis. That's what I call it.
That's right. Well, we're going to have your name in Google now with the Family Pet Podcast, providing hope to our pet parents who maybe have a diagnosis of a neurologic disease with their pet. So thank you for joining us today to answer some questions. Now, we can't let you go yet because it's time as a neurologist. You're getting an opportunity right here to increase the brain power of our listeners because it is time.
Give me the knowledge.
It is time for you to share a fun fact with our listeners. This is something that you're going to share with us that will help us win trivia night or at least impress our friends and family at dinner. So Dr. Massicotte, what is your fun fact for our curious pet parents?
Oh my God, I love this one. I love this one. This one always gets me. I think about that. It's like, wow, that's crazy. Do you know that 25% of your entire blood in your body is in your brain?
I did not know that.
Wait,
hey, we're as two multi-gallon blood donors.
That's right. I've given a lot.
I have given more.
Okay.
I'm going to share this. I'm going to share this information with the Red Cross the next time I go in.
25% of my blood is in my brain.
Is that for pets and for people?
Yeah.
Or like anything with a brain?
Uh-huh. Yeah. Well, it might be like a point difference, but that's the number, yes.
Hey, I have a question related to this. So when you put your head down and you stand up and you get lightheaded, is that like the blood is just literally it's just a different pressurized? Because 25% of the blood in your body.
That's crazy.
That's a lot. That's why people are so scared when they come to neurology. That's a lot. They're like, oh no, what am I going to do with all this? Well, that may be my favorite fun fact that I've learned over the past 3 years. Maybe one. It's got to be at least in the top 5.
That is. It's good.
And
so she's got
one of them was that giraffes have the same number of vertebrae in their neck as we do.
Yes,
7.
they do.
I did
7 all over the place. Yep.
That was a fun fact that I have never forgotten.
Dr. Chrisman
shared that. That's exactly
what
Well, Dr. Massicotte, thank you for sharing some knowledge with our listeners today, providing hope to those that maybe have received a a diagnosis of a neurologic disease with their pet. So again, thank you for your time. For
You're
all of
very
you
welcome.
for all of you curious pet parents out there, we hope you have learned this. Share this episode with a friend, especially if you know that their pet is going through a neurologic issue. Share this and provide them some hope. And until next time, stay curious.